I'm going to be quite quick today and really not talk through the new framework in any great detail, but just to tell you a bit about the work more broadly. It seemed like a good chance to chat about the framework. We launched it 2 weeks ago, and the amount of discussion we've had around indicators in relation to the framework is amazing already. So it's kind of the next topic off the list in relation to the framework. Just for people who aren't familiar with VicHealth, we are the Victorian Health Promotion Foundation. We're a statutory body who are funded by the Department of Health. We're often confused with the Victorian Government Department of Health, so it's separate but very much working with the department. And really we've been around for 26 years, I think now, working on a range of health promotion programs, advocacy, focused on both kind of traditional risk factor health promotion, but also looking at social determinants of health. And I will try to limit the amount of health promotion jargon that I use in this, because I agree, we're terrible at it. But really, kind of what I'd call traditional health promotion and broader health and wellbeing, like we've all been talking about today. Fair Foundations was launched 2 weeks ago, and it was really the culmination of a couple of years of work on one neat little piece of paper that you've got in your hands now. So I just really wanted to take 10 minutes to tell you a bit about where that's come from, why I think it's particularly relevant to some of the conversation we've had today already, and hopefully how we can continue to work with you guys, and we will be working with CIV in what comes next for Fair Foundations, and particularly how that links with the indicators and the discussion we've already had around indicators. So why this framework? VicHealth's famous for producing frameworks. We love a good framework. This one's a bit different to some of the others that people have mentioned today. We're known for kind of one-page determinants frameworks, and people have been talking about the Prevention of Violence Against Women framework today. It's always fantastic to hear how they're being used out in the real world. This one's a bit different in that it's not about bringing together an evidence base around an issue. It's really about trying to provide a bit of a map to think about the way that health inequalities or inequities are created. So this stemmed from, at VicHealth, I manage a team around equity. It's been very much a key issue for us. Everyone's really keen to do something about it, but we all talk about it in a slightly different way and understand the processes through which health inequities are created in slightly different ways. So we said it'd be great if we could get on one page a really simple roadmap that describes the pathways through which health inequities are created, and talk about health inequality in a way that isn't always about priority population groups. So we typically talked about people with disabilities, CALD communities, Indigenous Australians as our priority population groups, because they're the people who experience health inequities. But people don't exist in boxes like that. And so, okay, how do we think about it, take it up a level and think about what's the kind of common issues or the common determinants that those people are experiencing or missing out on in society, and draw a bit of a map. And that's really what this framework is trying to do at its simplest. It's, as I said, it's been a couple of years of work, so we've also been working, as a lot of you have, focusing really internally how we work across our organisation, but then thinking lots of people are having similar conversations in your own organisations, and we thought this would be a useful piece of work to share. We came up with a draft of the framework in June this year and then took it out to consultation. So we did a bit of a roadshow around the state of Victoria, talked to over 200, mostly health promotion practitioners, and you can kind of categorise those broadly: local government, community health, women's health, people from transport, a whole range of other health-related health and wellbeing issues. Showed them our draft framework and said, what do you think? What parts make sense? What's missing? Will this be useful in your organisation? What should we change before we come up with a final version? And that's really what helped us get to where we are today. I should say the framework, this isn't about VicHealth going, oh, we're doing all the thinking about health inequities. If people are familiar with the World Health Organization Commission on Social Determinants of Health, it's a mouthful, that report that came out in 2008, we've used the conceptual framework that underpinned that work and then adapted it to be more practical. That's really where this has come from. We're not recreating the wheel or changing the world. We're just saying that was a really useful piece of work that was done by hundreds and hundreds of the brightest people across the world. How do we take what was a really complex conceptual framework and create a practical tool? We think it's practical for health promotion. That's what we've got. How that's different from other things that might be around, there's lots of tools around focus on equity, is that we've really tried to marry that conceptual basis, so really understanding the pathways and simplifying the pathways through which health inequalities are created, but then saying what can you do about it. So rather than just describing problems, actually starting to unpack, okay, how do we actually start to address some of these really difficult issues? Who are the types of people that we should be working with? Where do we fit into this bigger picture, essentially? given it's only been around for 2 weeks, it's hard to say how people are using it, but what I can tell you is when we did the consultations, how people said it would be useful, and I'm pleased to say most people thought it would be useful. The consultation process in itself was incredibly useful, but also quite confronting to kind of ask 200 people to critique your work while you're in the room. We're lucky that most people liked it, but people were kind of, in a fair way, ruthless about saying, nah, don't like that bit, doesn't work, that, you need to change that, which was incredibly helpful, and we got our skins got thicker as we went through each session. So where we've arrived at now, it's still not perfect. We're still going, next time when we update it, we'll change that. But if you have a look at the version you've got, you've kind of got two versions of the framework. So the middle one is the summary, and then you get into a bigger version that has all the detail. I'm not going to spend time talking through this. You can read it yourselves, and there's also a automated Prezi on the VicHealth website that actually talks you through it. So if you want to have a look, you can do that. Otherwise, I could stand here and do it, which will waste your time today. But just to give you a sense of kind of the basic premise of the framework itself, as I've been listening today, thinking, yep, I think the framework helps in that way. Maybe we missed that. But what it tries to do is provide a framework for integrated planning, because no one organisation can do all of this. But it also starts you to think about, kind of the causes of the causes. So in terms of health inequity, what are the things that are going on that are meaning people experience differential health outcomes? Often in health promotion, at its kind of its traditional focus, we look at the individual health-related factors level. You can see it, and this is a framework that you can kind of come in at any level. Often we think about, we know that, for example, there's inequity in obesity, there's inequity in healthy eating, physical activity, all those traditional things that we work around. But what is going on to create that? I think Carolyn was talking before about, I'm trying to think what the issue was, and you were saying, we've got to think about what's happening for people. Was it crime or drug use or something? Yeah, so it's about, you can look at the data in relation to a specific issue and try to work out what's going on, but how do we start to unpack what's actually causing those issues? And so really that's the premise of this whole framework, is starting to think about, health inequity is actually created at the kind of the deepest roots here in the socioeconomic, political and cultural context. It's really hard to change that. Sometimes it's overwhelming. Not every organisation can do anything about it, but actually we should all be aware of it at least, and think about who are the people that we could work with, who are the players, what are the levers that we might have, and every organisation might be able to play some advocacy role, but they're not going to be able to change, societal values in one foul swoop, for example. The important thing about that base layer is it also creates a process of this is where it gets a bit jargony, social stratification or positioning, where people get assigned to various positions in our hierarchy. We often like to think that we don't have a class society in Australia in the way that other countries do, but we know that people are positioned differently in their social structure because of governance policy, norms and values, etc. And often the indicators of social position are what's listed there, so education, occupation, income, race, ethnicity, gender, Aboriginality or disability. So it's starting to think about, what does that mean? If we know that social position is created here and it runs all the way through this framework, how do we think about it in all the work that we're doing? And that's slightly different to thinking about how do we address priority population groups, because we're thinking about a process. So I'm going to get too much into detail here, I'm not going to do that. So really, if you keep going up the levels, we think about daily living conditions. There's some of the, what we traditionally call social determinants of health, education, employment, social connection, some of the things we've been talking about today. How are they impacted by people's social position? And as you keep going kind of up to the top of the tree, how does that then influence individuals' health-related risk factors, the more traditional health promotion, and then what does that look like in terms of outcomes? When I had a look when I arrived today at the data framework for CIV, because one of the things that people said to us through the consultation process is, that's great, yep, this is really useful. How do you start to get indicators at each of these levels? That would be really useful. We went, yep, absolutely it would. We need to do that work, but we can't in the next 3 months to get this out. So it's kind of like this is step one, and then we've got a whole range of other products that will come along with it. And when I have a look at the data framework here, you start to think you could almost work out, if you look at the different layers of the framework, how these things start to fit in, some of them at least. And so I think we've got a lot of work to do, and our partnership with CIV will be really valuable here in terms of thinking, if you're starting to do work at each of those levels of the framework, or the levels that you can influence in the framework, what can you expect the outcomes might look like? What are the types of changes that we would see in community indicators, in society more broadly, and in individual changes? So one of the things we're doing next with the framework is VicHealth's got a new strategic plan, our Action Agenda for Health Promotion, which has 5 strategic imperatives or 5 priorities. For each of those, we're now doing a process of doing an evidence review that uses the framework to overlay what's the evidence for addressing health inequity in, for example, physical activity, healthy eating, mental wellbeing, alcohol and tobacco use. So if we understand that's the kind of broad pathways, what does that mean for specific issues? And from that, what does that mean for specific indicators of change at each of those levels? So I know I'm covering a whole lot of stuff here, but just saying this is really the first step. We'll think about how this particular roadmap works in relation to specific issues, and then how you would actually start to think about what the impact of that work would look like. And so I've been, furiously, thank you, noting down stuff today, and I think I need to be going out, in the way that we did through the consultation process, and talking more to people who are using indicators in their day-to-day work, and thinking about how could we best marry the best of that work with this as well. So just to say, this is the start of a conversation, I hope. That's certainly what we said at the launch last week. We had lots of people who came along to the consultations. I know there's some people who were involved in the consultations here today who came back and to see how things had changed, and that absolutely did change as a result of what we heard. But we said we want to keep talking to you to make sure that this product is as useful as it can, that we can continue to develop it over time, and hopefully it can just get better, because it's really hard work, but you kind of got to go, okay, that's enough, we're going to start somewhere, and this is where we've decided to start. So was I actually going to tell you anything else about it? Look, that's probably enough. I unfortunately can't stay around for the rest of the day, but if people have questions or wanted to follow up with any of this, please do feel free to give me a call. My details are on the VicHealth website. Be very happy to have a chat with any of you. So thank you.